Have you ever wondered why people have different blood groups? Some are A, B, AB, or O, while others are Rh positive or Rh negative. But what does this actually mean? Understanding your blood group is not just a random fact, it is crucial for blood transfusion, organ transplants, and even pregnancy. Today, I will explain what determines your blood group, why O negative is the universal donor, why AB blood group is universal recipient, and why blood types matters in medicine. Hello, this is Doc Fever. If you are new on channel, let's subscribe the Doc Fever for more medical videos. So today we are going to discuss the blood groups. What determines blood groups? Blood groups are based on antigens, special proteins and sugar found on the surface of red blood cells. These antigens determine which blood type you have and how your immune system reacts to foreign blood. There are two major blood group systems, ABO and Rh system. The ABO system categorizes blood into A, B, AB or O groups, while Rh system determines whether your blood is Rh positive or Rh negative. These two systems combine to form your full blood type, such as it is A positive, A negative, or B positive or B negative. The ABO blood group system. The ABO system is based on the presence or absence of two main antigens on red blood cells A and B. Let's go through each blood type. First of all, we will discuss blood type A. Blood type A has A antigen on red blood cells and they make antibodies against B blood. So you cannot transfuse blood type B to blood type A because the blood type A has antibodies against blood type B. Blood type A can only receive from A and O blood and they can donate to A and AB types. Second is blood type B. Blood type B has B antigen on red blood cells and they makes antibodies against A blood. So you cannot transfuse blood type A to blood type B because they have antibodies against blood type A. Blood type B can only receive blood from B and O blood and they can donate to B and AB type. Next is the blood type AB, which is also called universal recipient. Why it is universal recipient, we will talk about it later. Blood type AB has both A and B antigens, but the blood type AB has no antibodies, meaning it can receive any blood type, but it can only donate to AB type. Next is blood type O, which is also called universal donor. Why it is universal donor, we will talk about it later. Blood type O has no A or B antigens, but they has antibodies against both A and B. They can only receive O blood but can donate to all blood types. Next we will discuss about the Rh factor. Why some blood types have Rh positive or negative. Rh factor is another protein on red blood cells. If you have it, you are Rh positive, and if you don't have it, you are Rh negative. Why does the Rh factor is matter? It is important for blood transfusions. Rh negative people can't receive Rh positive blood, otherwise it can cause hemolytic reaction. It is important during pregnancy. An Rh negative mother carrying an Rh positive baby may develop antibodies against the baby's blood, leading to complications. If an Rh negative mother is pregnant with an Rh positive baby, doctors give a special injection which is called Rogam injection to prevent problems. Next we will discuss why does blood type matter in medicine. Blood type is not just knowing about whether you are A or O, it plays a huge role in life-saving medical treatments. Here we will discuss why. First of all, blood transfusions. In blood transfusions, question arises why matching the blood type is important. So its answer is your immune system is trained to recognize your own blood type. If it detects foreign antigens, it attacks them, leading to dangerous reaction which is called hemolysis. It means destruction of red blood cells. For example, a person with type A blood cannot receive type B blood because type A blood has antibodies against the type B blood. These antibodies attack on the B blood red blood cells. In blood transfusion, key rule is the blood must be carefully matched before transfusion to avoid deadly reactions. Second is organ transplants. Here question is arise in organ transplant why blood type compatibility matters. When someone needs a kidney, liver or heart transplant, blood type compatibility reduces the risk of rejection. For example, a patient with blood type B can only receive an organ from the blood type B and blood type O. In the organ transplants, key rule is the closer the match, the better the transplant success rate. Third is pregnancy, how the Rh factor affect the baby. If an Rh negative mother carry an Rh positive baby, her immune system may treat the baby's blood as foreign antigen and attack it. This can lead to hemolytic disease of newborn, which causes anemia and other complications. To prevent this, doctor give a ROGAM injection to stop the mother immune system from attacking the baby's blood. The Rh factor must be checked during pregnancy to prevent complications. Why is O negative the universal donor? The O negative blood is called universal donor because it can given to any blood type in emergencies. Here is why. Because O blood has no A or B antigens, meaning it will not trigger immune response in any patient. O negative also lacks the Rh factor, making it safe for both Rh positive and Rh negative recipients. Because of this, O negative is always used in trauma centers, ambulances, and emergency rooms when there is no time to test the patient's blood type. Here is key rule: if you don't know patient's blood type, give O negative blood, it is the safest option. At the last, we will discuss why is AB positive the universal recipient. People with AB positive blood are called universal recipients because they have both A and B antigens, so they won't attack A or B blood, and they have the Rh factor, so they can receive both Rh positive and Rh negative blood. So the AB positive people can receive blood from any type without any issue. Let's recap. Blood type is determined by A, B and Rh antigens. O negative is the universal donor while AB positive is the universal recipient. Blood type matching is important for transfusion, transplants and pregnancy. So do you know your blood type? Let me know in the comments. Here are some exam questions to test your knowledge. What do you learn from the video? What determines a person's blood type? Option A is the shape of red blood cells. Option B is the presence of specific antigens on red blood cells. Option C is the number of white blood cells. And the option D is the level of hemoglobin in the blood. Question number 2 is a person with blood type AB positive can receive blood from which of the following groups? Option A is only AB positive. Option B is only O negative. Option C is all blood types. And option D is only A positive and B positive. Question number 3 is what type of antibodies does a person with blood type A have? Option A is anti-A. Option B is anti-B. Option C is anti-O. And option D is no antibodies. Question number 4 is a 25-year-old woman with Rh negative blood in pregnancy with an Rh positive baby. What is the best course of action to prevent hemolytic disease of the newborn? Option A is administrate IV iron supplements. Option B is give ROGAM injection at 28 weeks and after delivery. Option C is perform an immediate exchange transfusion. Option D is monitor the baby postnatally for jaundice. And question number 5 is a patient with blood type O negative requires a blood transfusion in an emergency. Which blood type can they safely receive? Option A is only O negative. Option B is any Rh negative blood type. Option C is any O blood type. And option D is only AB negative. If you like the video, like and share the video and subscribe the Doc Fever. Thank you very much.